Welcome back to the program Conversations with Zelisa, where we continue to inform, educate, empower and answer those unanswered questions. Joining us this morning for a very brief time, and I just told her we need a little more time with her, is Dr. Damari Melissa Baptiste. She is the Chief Medical Officer at the Community Hospital at the Seventh-day Adventist. Let me say good morning and a warm welcome.
Good morning.
She's originally from St. Vincent. She's here in Trinidad. She's just taken up her post.
Yes, I started at Community Hospital March the 1st.
Yeah. Tell us a little bit about your experience in Trinidad.
It has been very rewarding so far. It's a pleasure to be able to serve at the Community Hospital. I see it as an opportunity to give back.
Yeah.
In my journeys, in my medical journey so far, I have, lived a lot of places, and so relocating to Trinidad now is just an opportunity for me to minister. I see it as a ministry.
Very nice.
Because the passion that I have for medicine, and in particular women, is really about empowerment and education. So that's why I'm very pleased to have this opportunity, to be able to share as well.
And I can assure you, when I know that you're on your way out of Trinidad, we're very fortunate to have you today. That's why our time is quite limited. But when you return, we're going to be spending a little more time with you.
Sure, my pleasure.
Because I think women's health is important.
Absolutely.
I think as women, educating ourselves, it's a never ending. It's something that we should always be able to take responsibility as women to take care of our health.
And I agree with that 100%. You are the CEO of your own body.
I like that you've said that. You're the CEO of your own body.
Yeah, so the responsibility is on you to know your own body.
Yeah.
So that when something is wrong, you actually recognize it and seek help as needed. Immediately, exactly.
Immediately. A lot of people procrastinate. They see signs and they're in pain or they're having problems, and we are going to quickly talk to us about abnormal uterine bleed.
Yes.
And could you, and I just want to elaborate on the point that we should not allow whatever symptoms we're facing or problems we're facing, the challenges when it comes to our health, allow it to go into a week and then a month and then years, and then you want to fix it. Nip it in the bud, get to the source, do research, get to the source, get to the root, and get rid of it, and live a happier life.
Absolutely, absolutely, and that's key. So in terms of abnormal uterine bleed, it's very common. It's a condition that affects women in their reproductive years. So you're talking about teenagers from the point of puberty all the way down to menopausal years. And the term is different if you have experienced menopause and you're having abnormal bleeding. We usually term that post-menopausal bleeding. So abnormal bleeding in women, it's something that is very common, and as a gynecologist, because I'm also an obstetrician, gynecologist and a gynecology oncologist, is something that we see possibly 1 in every 2 patients that present to a gynecologist may have.
Is it that serious,
yes,
Doc?
May have complaints.
So in terms of young girls, teenagers, excessive bleeding, I've heard of young girls bleeding for months.
Yeah.
Months upon months.
So to understand the concept of abnormal uterine bleed, we first have to be familiar with what is normal. And when we talk about a normal bleed or a normal uterine or vaginal bleed, it's pretty much we're having a conversation about your menstrual cycle.
Right.
Because we consider that normal.
Right.
And in terms of knowing what is your normal, individuals should be aware that they should understand that your menstrual cycle ought to be roughly between 28 and 36 days. So you should have a regular cycle. It should fall within that time. You should be able to speak about the duration of your bleed. So anything that is over 8 days of bleeding is considered abnormal. And also you should be able to understand that your bleeding should have some amount of quantity or volume.
Right.
So anything that is over 80 mils of bleeding is considered abnormal.
Now, for the benefit of those who do not understand what is 80 mils, how do we know? Because there are lots of women who bleed, but they also have a lot of clotting.
And they think that is their normal, or they think this is normal.
Right.
Everybody gets clots.
Right.
So to put it in context, 30 mils would be considered about 2 tablespoons. So 1 tablespoon is actually around 15 mils. So if we're talking about your whole menstrual cycle, and let's say you have an average of 5 to 7 days of bleeding, you shouldn't have more than about 6 tablespoons of blood.
Okay.
Or let's think about a 250 mils box drink. Really, it's about quarter of that, a little over quarter.
Okay.
So anything that is over that is considered abnormal. And we could put it in the context of the pads that you wear.
Right.
So if you are changing more than 3 pads that is fully saturated in a day, then you should seek some sort of medical or gynecological intervention.
So women, I'm talking about particularly now mothers, grandmothers, aunties, nieces, you know, teenagers. If you, or mothers, if your daughters are saying X, Y, Z, then you know something is wrong. You identify something is not right. Please get help. What can the hospital of the Seventh-day, the community Seventh-day Adventist, I know that you are on a campaign with regards to women health.
Yes.
So how can women now know that they've got a program there to identify to help women in such situations?
All right. So women are really the backbone of our nation. There is no male without a woman. We all came from a woman.
They are the prime ministers of your home.
Absolutely. So therefore, it is in the interest of every male to also want to take care of the women in their lives.
Correct.
And if you would allow me, abnormal uterine bleeding, the causes of it are widespread. So we can have a conversation about the structural causes and the non-structural causes. And just briefly, just to name some of the reasons why people may have abnormal uterine bleeding, it would be issues such as endometrial polyps, and that's an overgrowth of tissue that lines the lining of the womb in a female. Then you have issues such as adenomyosis and endometriosis. Then you have uterine fibroids, which a lot of individuals have. There's a genetic composition to it. In terms of our Caribbean women, almost 1 in 5 women will have uterine fibroids. And then there's malignancies as well. Those constitute the structural reasons of having abnormal uterine bleed. Then the non-structural reasons would be things like a bleeding disorder, like a coagulopathy. Then you have some certain medications that could cause it. Then we have ovulatory dysfunctions or hormonal imbalances, such as polycystic ovarian syndrome.
Correct.
So all these issues can combine to cause abnormal uterine bleeding. So
would this lead up then to infertility?
Yes, some of these issues can contribute to in fact, most individuals that present with abnormal uterine bleeding would also complain that they've been trying to get pregnant for a certain amount of time.
I would love to continue this conversation with you because of our time constraints. We've got to wrap things up at this time. But an open invitation, and I see the need now for constructive conversation designed for women with such problems and other problems we face as women. And I like to always repeat myself by saying prevention is better than cure. And we need to always get to the root of the problem in order to solve it. so that we could be healthy and happier women.
And in terms of what community can do, that was the question you just asked me.
But we're certainly going to continue
Okay.
our conversation on
Sure.
another day and time.
Okay.
But I want to thank you. I know that you're flying out. I want to wish you a safe journey.
Thank you very much.
You accommodated us, and I mean, I'm happy that you've made the time, a little introduction. But the best is always yet to come.
Of course.
And we look forward to you joining us very soon.
Thank you very
again.
much for having me.
God bless you. A safe journey. We'll see you very soon.
Thank you.
So this is where we've got to wrap things up at this time. I want to remind you to respect the law of the land, that with God all things are possible. I also want to remind mothers to pay attention to your daughters, and when they're having their health concerns, have a constructive conversation and get help earlier o'clock. All right? Thank you so much for choosing us. Have yourselves a blessed, safe and beautiful day. Stay safe, stay happy. I am Zalisa Budu Singh Rupani. Thank you so much for choosing us. Do continue to stay with us on U975 FM Multicultural Radio, programming with you in mind.